Welcome to Health Talk. This is Dr. Ashish Chauhan, consultant physician from Apollo, your host. What are we going to talk about it today? Yes, you are watching this program with your beautiful eyes. Eyes, window to your brain, is what we medical doctors call all about. Eyes are the most important part of your body because with this you see the beautiful world around. Today on this important organ we are going to talk about various things related to the disorders associated with it. And with us we have Dr. Umesh Bhammarkar, the consultant retina specialist from Sadhuram Eye Hospital. Dr. Umesh has been working and practicing in Hyderabad from last decade. Welcome, sir.
Thank you, sir. Thank you, sir, for calling me here for being interviewed with you.
Eye disorder, how common it is, Umesh, with respect to the numbers?
Eye disorder, sir. In eye disorder, we are having so many things, and commonest cause of loss of vision or diminution of vision in children and especially in young age also, that is a refractive error. In Hindi we call it as chashma ana. They are not knowing the things, they are having refractive error. So they keep struggling in school or in daily activity in seeing in proper way.
And in young age children will not be able to express themselves also.
Most of the time if things are in one eye, they may not notice the things in early stage.
Yes.
But due to some reason, if they are closing other eye and they are seeing the things, then they realize oh, in one eye the things are not very good.
So refractive error is very common.
Very common. It is one of the commonest cause of loss of diminution of vision. This is.
And how does it affect anybody's life? Say, I know reading and writing is probably tough. But does it affect a normal work also?
Of course, professional work, sports work activity and routine activity like going here and seeing the bus numbers, catching the vehicle, driving the vehicle. So many daily activity where we are encounter fine vision or distant vision that can easily affect with this refractive disorder.
And how badly it affects our normal routine life and what we can do about it?
Yes, if a number is very high, some patients are having more than -12, -14 number, so they may not able to see more than 1 meter or 2 meter.
Okay.
Yeah, so that's their vision is limited to just 1 or 2 meter. So in such cases, depending upon their refractive status, we can give them glasses. With most of the time, if things are okay, they are rectified with the glasses by giving proper glasses. And sometimes these high cases may be associated with retina problem. So in that cases, we need to intervene accordingly.
Okay.
And especially young school going age, the students, those who are in first standard, second standard, or up to 10th standard, those who are sitting in the last benches or back benches, okay, they cannot able to see the boards properly.
And
so
then it gets misinterpreted that they are not performing
performing well.
They are not concentrating in the class.
And peer group pressure from the friends and school teacher also. But nowadays, all schools are having good policies. They are making sure that all students should get checkup for eye screening. Because so we can.
So how early anybody should do an eye screening? Say suppose for people who are watching us today. Now, do you believe that even when the child is born, the screening should be done? So how early is the right time?
Yes, you are talking about the if child is born. Not necessarily all child should be screened for this refractive error, but the babies who are born prematurely, maybe less than 30 weeks or maybe weight of birth is less than 2 kg. Then there is one condition called prematurity of retinopathy, ROP. So in that cases there are high chances that patient may go blind because there is a retina formation delay development or sometimes that may not develop properly.
Okay.
So that is one of the most dangerous condition in pediatric age group, especially newborn condition.
Okay.
So in such cases the risk factor are premature birth, low weight, more than less than 2 kg and multiple blood transfusion, respiratory distress syndrome and other problem associated. In such cases we need to screen the retinopathy early age, maybe 20 week.
So when the child is born, so who advises usually? The pediatrician advises, or
pediatrician,
people have to know about it and they should demand?
Generally people are nowadays knowing the awareness of retinopathy of prematurity, but most of the time the pediatrician and neonatologist of respective hospital, they are advising as a part of wholesome checkup.
So okay, that is for the young children which are less than 2 kgs, neonates. What about the general population?
If students they are feeling कि that they are not seeing properly. Most of the children, they don't tell their parents, maybe due to fear कि someone what their parents will say.
Probably they don't even know, because they don't know that it is abnormal to have a less vision and stuff like that. So
in such cases, later they develop condition called lazy eye. We call it as amblyopia. In this, one eye may not be used properly and other eye is suppressed. So they are using one normal eye promptly and other eye getting less vision. So that is also untreatable condition in later age. So especially 1 or 2 year age, if we are seeing some problem, we can check to the respective our eye.
So I think only a good teacher will be able to find out what is happening.
And parents, nowadays parents also. Even there is no harm in checking routine examination after 1 or 2 year. So we can pick up the things in early stage. So can rectify easily.
And so whenever there is something found, spectacles are the only answer? Or
most of the time, if it is simple refractive error, maybe myopia or some astigmatism, so most of the time in young age, spectacle will do better.
And but a lot of us have this stigma, younger child having glasses, spectacles. So is there a way to avoid?
Nothing like stigma. If you are seeing things clearly, so that is only stigma to the other people, not student or not patient.
I know. I am uncomfortable because the glasses gives the intellectual look. So even I want to wear the glasses for the cosmetic
That's perception nowadays. And stigma to the especially young ladies, those who don't want to wear some model profession and some fashion designing profession, they don't want to wear the glasses. For that, in later age, we have some different modality to remove glass in the form of refractive surgery, maybe LASIK surgery and ICL and different form of surgeries to remove the glasses.
And otherwise, if there is really issues, then you can use the contact lenses.
Of course.
That always works out. The market is growing for that. So besides refractive errors, what are the other complaints patients present to the eye OPD in your cases?
In general, most common symptoms is a loss of vision or diminution of vision or quality of vision is deteriorated. This is first symptom, most common. It's a refractive error, as I told. In older age, second cause is that cataract. In Hindi we call it मोतिया बिंदु आ गया, तेलुगु में शुक्लम बोलते हैं जो. तो after 50 age that there is a loss of vision and that is operable condition. If a person is having cataract, we can operate the cataract and we can put artificial lens inside the eye, so that quality of vision will be better.
Now I am very sure most of us have issues with respect to the surgeries. So is there some tablet or a medical prescription?
No, absolutely not.
So once there is a cataract,
it is aging process. Cataract is just absolutely aging process. Maybe after 60, 70 you may have that different stages of cataract. In that case we need to operate. There is nothing like magic drug, you will take this thing and this will not happen.
So operation only is the answer. And besides this operation, what all things are required to be kept in mind when there is somebody who's got cataract?
Somebody highest, because older patient, they most of the time they are having some systemic issue like hypertension, diabetic and some lipid things, some heart disease. So we need to control all that is parameter, and especially sugar and BP should be under control before operation.
And these operations we do, they are costly operations when you talk about
depends on these things. Not very costly. There are some nowadays laser phaco surgery available. Earlier it was only manual surgery incision, so it was a little bit bigger incision. Nowadays with availability of recent advancement and new technology and equipment, things are very easy. And that
you use the word phaco emulsification. What is that?
That is just like ultrasonic machine which emulsify the cataract, and so we need not to put big incision, and just we are emulsifying cataract and removing that and putting lens.
So it melts the cataract and we remove that. So word cataract means that opaque lens, opaque lens. So it becomes like a rubber stuff and which we need to remove it. So we remove it and we put a new artificial lens. And how long does this lens work?
Lens lifelong.
Lifelong.
Once you remove the natural lens and you are putting the IOL or intraocular lens, then that will stay lifelong. With respect to the cost, what is the usual thing? Is it available free of cost also in the government? Free of cost in government phaco nowadays not, because it is costly. And of course other modality like small incision surgery, cataract, that is of course free of cost. Even in charitable trust hospital like our hospital, Sadhuram Hospital, we are doing lots of charity work and we are providing free of surgery for cataract, but that is basic surgery. But those patients who want to take higher lenses, higher package, higher quality of this thing, definitely higher things come with cost.
So suppose, it's always nice to have some figures. If somebody has to consider some
basic
cost,
things is from 12 to 15,000 basic lens. If they want to have some important lens, foreign made lens, that goes up to 1 lakh also.
Okay. So
and different type of IOL also. That is, if patient is having some cylindrical power or some multifocal they want, so that cost go up.
Okay, but overall for majority of our viewers and everybody, government is providing free of cost the basic surgeries which usually restores the life, the eyesight completely back to the normal, right? Okay. So besides cataract and refractive error, what are the other problems which we see? What is glaucoma? I think that's a term.
Glaucoma, yes, it is very blind condition, okay, and very dangerous condition. Just like hypertension, blood pressure, we have high pressure of eye.
Okay.
So that is called, we are calling glaucoma, rise intraocular pressure.
Okay.
Normal pressure of eye is from 14 to 18.
Okay.
But sometimes patient may have that higher pressure, IOP more than 24 or something more than that. So that optic nerve get damaged over a period of time, maybe 1 year, 2 years, and it is progressive disorder.
Okay.
Just like BP, hypertension, we are taking lifelong treatment. Once we are having glaucoma patient, we need to give treatment for lifelong.
Okay, glaucoma has to be lifetime treatment.
That's right.
So tablets usually work?
A tablet drops in the form of drops, topical eye drops, most of the time that we are controlling, one medication, two medication. If still pressure is high, there are some surgery for glaucoma.
Okay.
We call it trabeculectomy surgery,
yes.
AGS. So that with that also that things are fine.
Okay. And now coming back to your speciality,
thank you.
say retina. So
again retina is आँख पर्दा जो बोलते हैं हिंदी में, just like a small sheet of film, okay, from where light is transmitted to the brain.
Very complex structure.
Very complex structure, and that most of the time once the retina disease develop, managing that may be difficult.
Okay.
But with new instrument, new technology, now we are easily that managing the things. But still advanced stage are still that not so good. In spite of all having things, result may not.
So can you have a retina involvement without patient knowing it?
Of course. Most of them patient, they don't know whether they are having retina problem, refractive error problem, cataract problem. Okay. Suppose patient is having diabetic since long, 10 year, 12 year.
Oh, we are in a diabetic capital
of world. Yeah. So most of them, they don't know. They never go to the ophthalmologist. Basic problem is that they go to the simple chashme ki dukan. Chashma kam bhi dikh raha hai, to they will carry forward this.
Okay. So casual approach is something which is causing more damage. So how often does an average adult should go to an eye specialist?
At least once in a year.
At least once in a year. Okay.
If they are diabetic,
even when there is no complaint.
Of course, yeah. No complaint. There is no harm in checking the things.
Yes, I think that's a big take-home message for all of our viewers to understand that yes, opthal checkup or eye checkup is very much important for anybody who is an adult age, and that is once in a year, even when there are no complaints. Right. What about the diabetic patients?
Depend upon the stage. If a patient is having diabetic for more than 10 years, and initial one checkup is required. Okay. If that any stage of diabetic, suppose early stage of diabetic, mild or moderate, and PDR is there, so we can just follow up every yearly. If advanced stage of diabetic, then depend on the treatment, how we are treating the things.
Okay.
So because this is again tricky thing.
What does it cause? Diabetes causes what problem to the eyes?
Diabetic also diabetic retinopathy. There is a bleeding inside the retina.
Okay.
There is a swelling over the macula. Macula is a part of retina where we can see fine vision, color vision, and that accurate vision.
Okay.
So once that got affected, so your quality of life will be blur and a little bit distorted, and that tilted.
Okay.
So you will say only one part may be missing, so that hamper your quality of life and your profession also.
Okay, okay. So can we stop it by any chance?
No, we cannot stop. We can rectify to some extent, and we can stop by giving some treatment to further progress.
Okay.
That only we can do.
Okay.
But it's not like that if you are doing these things, things will not happen in future. So that's why follow-up is very important.
And one thing which I would want to hear from you is, does the retina problem start before the detection of diabetes also?
Yes.
Okay.
Yes.
So that is something which I would wanted to hear from sir and communicate, that eye problems of a diabetic patient starts before even a patient has been diagnosed as a diabetes, almost 5 to 10 years.
Daily, every month, few patients I am seeing, those don't know that we are affecting from diabetic. Just by simply seeing their eye checkup or retina problem, hemorrhage or bleeding inside the eye, we can just work out the patient, and then we find that then this patient is under diabetic category. Is
diabetic category, and maybe with normal sugars will be surely falling into that category. So that's good. So what all things can we do about the diabetic retinopathy? retinopathy.
Diabetic retinopathy depend upon again stage of diabetic retinopathy. If it is early stage and not much things, then we can follow up and do the systemic good control, glycemic control, as you are expert in that, glycemic control, hypertension control, lipid control. Most of the time with this stage of patient that they do are fine, but follow up is again important because they can land into next stage anytime.
So what is that? What is the complication?
Complication of diabetic retinopathy, vitreous hemorrhage, bleeding inside the eye, full
bleeding inside the eye.
So that can immediate cause loss of vision. Then again is the retinal detachment.
Okay.
Traction retinal detachment we call this. That is operating condition.
Okay.
So in that condition we need to operate the patient to save the eye and to preserve the vision.
Okay. What are the other possibilities? Say, how early a diabetic patient should come to you?
Once he diagnosed as a diabetic.
The time patient is diabetes, okay, should
because
come.
we are not sure when, since how many years.
Should not wait for the complication or any kind of symptoms to occur.
Why to wait?
Earlier is better. Apparently, diabetes is the #1 cause of the blindness.
Yes, number one.
So, and that's why, because we are the diabetic capital of the world, so patients coming to
and in India it is 18 to 21% of diabetic retinopathy prevalence is there.
That's a huge
so
number.
Almost out of 100 patient, 18 to 20 patient we are having a different stage of diabetic retinopathy.
How comfortable are you, say, when the patient comes with complications?
Right.
Do you feel uncomfortable
of
that
course,
they have not been going
because of course in early stage.
And how costly and how rewarding the surgeries are?
Depend on treatment, sir. If early stage treatment we are medical managing, it is not very costly. But if some we are giving retinal laser or some intravitreal injection to come down bleeding or swelling, that is costing nearly 3,000 to 15,000.
Is that
Lucentis anti-VEGF injection.
Yeah.
So that come 25 to 30,000 injection because these drugs are very costly.
Okay.
And that other drugs, some Ozurix implant or all that, they costing nearly 35,000, all that. So depend on patient profile, or though all patient need treatment, but cost factor is huge. Sometimes patient may not take the treatment.
Let me tell you one thing from my side. I believe the diabetic patient will not have a heart, brain and other complications if he or she comes to me regularly.
Right.
Comes to a diabetologist or a physician regularly. So then obviously they will save on their money as well as they will have better quality of life. How it is with the eye?
Of course, sir.
The same thing.
At least that's why I am emphasizing on follow up. If you are in early stage, there is no harm in follow up every year.
Okay.
So we can prevent the next stage. Even if early stage we are saying the things, we can do the treatment and prevent the next stage.
Okay. So progression of diabetic retinopathy can be avoided.
Can be rectified to some extent, sir.
That's very
just
much
by managing by other systemic factor.
Okay. Besides this diabetic retinopathy, what are the other complications of diabetes we get it? How common are the infections of the eye?
Infection, nowadays seasonal infection, conjunctivitis we are calling, that is very common thing, sir.
Okay.
But for that we need only medical management in the form of eye drops. So most of the time that bacterial conjunctivitis or viral conjunctivitis, they are commonly occur during particular season. So that they are can be rectified with an eye drop within 2 to 3 weeks, sir.
Okay. I would be very happy if you tell our viewers the do's and don'ts about the normal care of eye, which you have found that patient has landed up in a casualty or in emergency, and maybe something which they could have avoided, because even trauma to eye is also very common. And so what are things would you want to suggest to our viewers?
The first things I will start with the kids, animal checkup of this thing.
Anytime, every school going child of that age should have a regular checkup.
At least साल में एक बार हो, so we can pick up the refractural in early stage.
Okay.
So if anything we can give the glasses and we can rectify to great extent.
Okay.
One thing. Second is in young age, growing age, the diet factor.
Okay.
That also occur. Sometimes
how does diet affect the?
Of course, growing age, that our retina is having some vitamin things or all that, that can supplement things.
Vitamin A.
Vitamin A is that this thing, carotenoid things.
Yes.
That is better for growing age.
Okay. Okay. So diet with respect to vitamin A. What else?
Other is old age. That patient, diabetic, systemic factor, hypertension, they should get regular checkup with their respective physician, diabetologist, and with you.
Yes, I've heard a lot of times some infections like that of tuberculosis or autoimmune disease get affected.
Autoimmune disease.
How do they affect the diet?
Of course, they affect the UL structure. We call it as uveitis or vitritis. So they are commonly systemic disorder, collagen muscular disorder. These are the.
So are you telling me that you can have a tuberculosis of the eye
Of course,
without having any symptoms at all.
Of course, sometimes most of the time I am seeing their patient are complaining of diminution of vision, loss of vision. We are ruling all the things but nothing, but we are anticipating some systemic factor. We are taking all the X-ray, all these things, all things negative. Then we are doing eye examination to finding some correlated with the TB, ocular tuberculosis we call this. So we need to treat as a systemic disorder.
I remember because you have sent couple of patients and it was very tough to tell them that you have a tuberculosis and they will say,
no, I don't have any symptoms, don't have cough, don't have any back pain, nothing, but still how we can this thing.
Yes.
But this can happen, sir.
Okay. There is one term which people talk a lot about, it is papilledema, raised
papilledema is due to head injury.
Okay.
Any injury inside the brain or that any tumor that is creating pressure over the optic nerve and that is raising the pressure of optic nerve.
Okay.
So in that structure of optic disease changes, that becomes swollen.
Okay.
So we call it as papilledema.
Okay. So that's what, so in your requirement in any systemic disease is much more than anybody else's requirement, just that people don't understand.
Yes.
Quite often I suggest for the eye examination and they will say, sir, we don't have any issues. And again we feel uncomfortable because we unfortunately gets labeled as a commercial doctor. So they say, why you are calling an eye examination when I don't have any symptoms at all.
Right,
so it's important to communicate and understand the need, because in India we have issues that doctors have too many patients and we are not able to explain it to our patients what is the need regarding the regular checkup and all those things. So with respect to diabetes in particular, for our viewers who are watching this program and have a diabetic patient in their family, what are 2-3 things you would want to tell them so that they can make sure that they never require eye surgery?
We cannot predict if a patient never requires surgery, but of course to some extent we can reduce the prevalence of these things. Okay. First thing, important things, your regular visit to your diabetologist, because he is the first person who is going to see you on regular basis, not your eye surgeon, not your other person. So that is the thing. So always all checkup in first go is necessary. Second, if you are having some diabetic stage of retinopathy, then as your retina surgeon or your ophthalmologist say, he regular visit, then these things. If we need treatment, then on time, or that on time treatment is very important.
Okay.
It's not like that we are stemming patient is having diabetic retinopathy and you are taking treatment after 6 months or 1 year, then things may not match.
Okay.
To these things.
So these are the most important things to be considered.
Yes.
Okay. For don'ts of the eyes, so for the parents who are watching this program, what they should be able to tell their children and how to protect their eyesight. What are things?
Nowadays stress induced or dryness is very common with watching TV, laptop or iPhone. बच्चा छोटा भी रहता है तो दिन भर मोबाइल में लगे रहता है.
It affects the eyes.
Of course, affect the quality of vision, and that this stress over the eye may create some rubbingness of eye, watering and some strain, some pain. This is one of the common causes nowadays what we are facing with technology. Every kid's cell phone, that one thing we can avoid it.
So that radiation has an effect on
radiation, of course, radiation.
So staying away from cell phone, laptop and mobiles is something
though practically not possible, but really helpful.
Kind of, at least people should know about it as much as possible we can avoid.
Younger generation, those who are working on the laptop system or all that, okay, continuously they are exposing to 8 hours of that radiation, of that these things, not radiation but this color, these things, so that may affect the quality of vision sometime. So regular dryness is very common. Sometimes they feel irritation watching, so some lubricant drop or other things with a consultation of ophthalmologist, that is better. Okay. And second is those who are having, is asking what we can avoid the things. Those who are having very high number, high minus more than 10, these things. So sports injury nowadays common. Normal people may not have that amount of trauma to the eye, what that higher number people may can have.
Okay.
So a small amount of trauma also that can create some problem.
Okay. Okay, that's fine. Quite often I have realized that general physicians and nephrologists ask for eye opinion when the eyes are completely normal. How is kidney related to the
microvasculopathy, sir?
What is that? For our viewers, if you can explain.
Kidney eye disease.
Yeah, how the eye is related to kidney?
This is microcapillary जो रहता है structure, that is a circulation, systemic circulation.
Okay.
Once kidney capillary damage, and that is related to the eye, that's circulation.
Okay. So one thing which we need to know as our viewers is, if there is a kidney failure, if there is kidney which is involved, the only way we can find out what type of kidney failure is there is by doing
retina examination.
Retina examination, Otherwise, the other option is where we do the
biopsy. That is the only
if
thing.
you want to avoid the kidney biopsy, the best way is just going to ophthalmic doctor and then getting the fundus examination done, because changes of the eye in diabetes correlates directly with the kidney damage. So, if there is a kidney failure and if the eye changes are there, then it is because of diabetic kidney disease.
And kidney disease, then there is no eye changes, then you need to go with what sir is saying.
So, that is what is a renal biopsy which we require it. If case that eye is absolutely normal and there is a kidney damage, then we need to go for a biopsy. That is what we need to understand. That is a thing. So, do you advise anything in this season particularly, because it is a rainy season everywhere, especially July, August, it rains heavily. How the eye protection with respect to rainy season would you suggest to our viewers?
Do not go to very crowded places, one thing where the chances of infection, especially swimming tank or resort, those who are having chances of higher infection. So, we cannot avoid going outside, but to some extent we can prevent this infection.
Okay.
So, and once it happen to somewhere in that any family member or any that kids in school, so we can just avoid going to school for 1 or 2 weeks or 1 week at least. So that other kids cannot get infection.
Yeah, that's usually we get it when there is a sty.
Sty, conjunctivitis, sir.
Conjunctivitis.
Viral conjunctivitis.
So is sty and conjunctivitis same?
No, sir. Conjunctivitis is different. Sty is just swelling over the eyelid. Okay, so that is
the external hordeolum.
Yes.
So that is what do you do, because people have a very misconception and a lot of thoughts about this sty that it comes. And what is a treatment which you suggest for our people to know for this?
Treatment for sty is small, most of the time with hot compression, and that is antibiotic, things will resolve.
Okay.
Okay, that is not these things. But sometimes people having recurrent sty, that is again call for investigation.
Okay.
By having, especially diabetic patient and some other problem, blood problem, for that we need to rule out.
Okay. And what about this, when we have read, India we also have a good number of HIV patients. So, how often do we get to see HIV?
HIV retinopathy, especially CMV retinitis, is very common. Those are immunocompromised patients, sir. So, most of the time that they are the patients who do not come to the eye ophthalmologist due to social stigma, as you are telling. Okay, they do not want to go or they do not want to take treatment. But as saw a couple of patients, those who are in advanced stage of retinopathy, and in that vitreous hemorrhage, traction retinal detachment, and all that happen. So we need to do surgery or some systemic, and systemic medication is very important.
Okay.
Like what we call HRTT treatment.
Yes, that is there. So, eye is what we have realized today with the discussion so many things with Dr. Umesh. We have learnt that eye is a organ which we first get impressed with somebody's smile and the way to talk, and that is one organ which gets affected by the whole body's involvement. Every kind of infection is connected to eye, whole part of body is connected because the kidney and eyes are connected together, and we need to respect an ophthalmic surgeon and reach them earlier, not late, because that is where they can do something at low cost. So, please reach your eye specialist regularly, much early before the complications occur, especially if you have a diabetes in your family, and definitely if you think your child is not concentrating and not getting good marks. You and me think that he is not concentrating, but primarily it can be because of his eye problem which he or she has it. If you are a teacher or a principal or a parent, make sure that you watch out why the grades are falling or why your child is inattentive in the class. Eye is an important thing. Moses, as in the character of Bible, lived 120 years without getting his eyes affected at all. So, yes, there is an iota of diet and exercise which we need to know, and above all, blessing of our Lord Almighty. If we remember that, we can stay happy, we can stay healthy with a bright eyesight. So, we thank Dr. Umesh for having come and for our program and having discussed all these things. Thank you, sir.
Thank you, sir.
Watch this program again with us with a different topic next time, same place on the same channel. Thank you for watching Good News Channel.